been going on for many years. These are only the cases that happened in 2024. So Mayo Clinic has been utilizing virtual reality for surgical training, including laparoscopic procedures, to enhance the skills of medical professionals by 95%. Just for the record, so I graduated from medical school about 11 years ago. Anybody who was in my generation or before that, they understand the significant value of how challenging our education system and environment was. It did not look that challenging at that time. That was the best that we were doing. However, in today's time, there are many more realistic approaches thanks to technology that we can utilize. The second success story is that Boston's Children's Hospital used virtual reality-based pain distraction program with 80% positive results. In my previous hospital, I was working in King Hamad University Hospital in Bahrain. We have had a similar program for pain distraction in children, and our result was 100% of success in certain criterias. Number three case in 2024 success is Cleveland Clinic. The team has explored the use of immersive virtual reality to decrease chemotherapy-induced nausea and vomiting in cancer patients, resulting in 40% of improvement in symptoms. Then, like many universities around the world, Harvard Medical School used virtual reality for anatomy education. Then University of California conducted studies on virtual reality exposure treatment for post-traumatic stress disorder, showing symptoms improvements in 60% of VR users. Now, again, another success story from my early days in experimenting VR. I was working in a burns unit, and we used virtual reality for pain distraction, especially in patients who would experience phantom pain. And the results were very significant. Now, how do we actually get there? Who is developing VR? Why doctors need to be involved? This is the whole topic of my discussion. So as a medical doctor working in virtual
Are the
reality,
slides moving? The slides are moving or not, Dr. Asra?
yes, they're moving. Yes. So what I do now in my daily practice is that I try to build the value of using innovation in a healthcare system. My example for the talk today is virtual reality. However, the objective is to keep our minds open about innovation in any technology that is coming. So what happens, or how would you integrate virtual reality in healthcare? First of all, the first question is identifying as an organization, whether we are a hospital, a clinic, or an institute, what is our objective for the future, for the next year, for the next 5 years? Is my objective to improve my training? Is it to improve patient outcome? Is it to improve the patient traffic? Or is it exploring innovation, which will hence bring my institute's name higher in innovation research? That is number one. Number two, once I have decided that yes, and once my team is believing that innovation is the way, I would definitely encourage to identify one user base. Everything that I do in my first project with any institute or organization is have a one sector for everyone. So user base would be identifying, are they healthcare providers? Are they medical students? Is it the patients or their families? Number three, what level of interactivity is required? Now, most of us have already at least have some idea of virtual reality is. Many of us, or almost all of us, know that it's about putting glasses on and then, you are in a different world and you're doing things. That is just part of it. The objective before that, before actually looking at any hardware, is first of all, think within ourselves is what do we want to achieve? Do I want my patient to be more engaging in the disease, in the treatment process? Do I want my training the students to learn more about the human body so that they can treat it better? And that will determine the level of interactivity with the certain technology. Question number four, which department can benefit additionally? So innovation, of course, this is a cost to the institute. If one department is using it, for example, in the previous slide, there was one case about using it for chemotherapy. That's fine. When Cleveland Clinic is using virtual reality for chemotherapy, which other departments can benefit from the same program? That is especially important because as believers in innovation, we want to keep the funding for innovation continuous throughout the coming years. Uh, Question number 5, how the success can be measured. There are various ways to measure success, whether it is verbal data, forms, measuring patients' outcome, measuring the quality. So identifying that. Last question, how much you can expand on the same program. Again, this question is very important because it helps organization to use the same technology in more places with the same investment. So the case that I have to share is from the United Arab Emirates. Al Jalila Children's Hospital is a very well recognized healthcare organization. And the way that happened is that almost all of my work in innovation, it starts with a grand round. All institutes and organizations do conduct grand rounds. Earlier, it used to be in some places, especially in the UAE and Bahrain, it's usually every Thursday morning. So what would happen is that I would attend the grand round and give a lecture about the value of virtual reality. And I did the same at Al Jalila Children's Hospital. The result of that lecture was it helps me identify who is among the audience, which is the healthcare staff, who is somebody who's having a different vision than the rest of them, who is someone who's more open to innovation. What happened at Al Jalila that I was approached by the head of the pediatric orthopedic department. The pediatric orthopedic surgeon approached me asking me that I think I can use VR in my clinic. Let's brainstorm some ideas. So this is how we identified, or we started to shortlist the audience for the VR. So the program that we developed is that we identified what are the 5 most common pediatric orthopedic related scenarios attending this particular healthcare facility in the past few years. And what we would do with those cases is that we would develop an immersive virtual reality based experience teaching us about that medical condition. So for example, the basic example is elbow dislocation. So we developed 3 different, what do you call these? Modes in the application itself. Mode number 1 was learn, which is only visualization. Mode number 2 was interactive practice. And mode number 3 was response. Mode number 1 means learn and visualize was targeting the parents of the patient. Often, the parents, of course, because of the nature of that department, it's pediatric plus it's orthopedic. Everybody is sensitive about their children, especially when they undergo something like a fracture or a dislocation. A virtual reality program can help the parent actually understand why this happened, how it happened, and how it can be fixed. All of this is today done when the doctor explains to them verbally. They may or may not sketch for them on a whiteboard or a paper. However, imagine if the parent is able to visualize what is happening inside and how can I benefit from, or how can I manage it? Or is it even manageable or not? Number 2 is the interactive practice. The target audience for this mode was the students and junior doctors to understand how they're going to solve it. Response was giving you a realistic scenario of the same challenge happening to one of the patients, and then how would you treat it? In the response phase, it is so realistic that if there is a delay in the action, it will reflect on the virtual patient. Although the patient is virtual, the environment is virtual, but the reaction and the fear that happens in the practicing doctor is real, preparing them for the future. Now, let's revise the previous question. One of my question was which other departments can benefit from this eventually. See, the presentation in 15 minutes time, it makes it sounds like it's very easy to do. However, I did spend significant months just going back and forth to the hospital, making them believe in my idea. One of the biggest challenges is the cost and the investment because generally hospitals may or may not have a budget allocated for a very particular innovative tool, right? So my conviction to them was that let's build this one application only with 5 cases only. It will be used, first of all, it will help the medical students in understanding. And from this, only we can, of course, identify or compare the results of people learning from the virtual reality compared to those following the conventional way. Number two, the same application will be implemented in the OPD waiting area. Why? Because usually the waiting area is where parents only sit, spend time waiting for the next appointment, and that's a panicking situation. From the clinic, they hear voices of the children's breaking, so it's all not a very productive experience. Having the virtual reality in the OPD waiting area actually helps parents access to the VR tool and understand how it's working, and also help them, of course, learn about the challenge that happened to their children. Research, of course, all of these activities are driving research. Also, the marketing department, of course, the marketing department will follow the permissions of all of the users, whether they are children or parents or even the medical doctors. And then, if permitted, they will use this news as a marketing for the hospital, which is, of course, a good word of mouth in general about the hospital. Return on investment is going to be obvious in the long run. As of now, we don't have a very clear-cut explanation on this, but I'm sure with this innovation, of course, the benefits can be various. Now, to the most important part, how did Al Jalila Children's Hospital expanded this program further? The hospital comes under Al Jalila Foundation, which actually has many programs around the world. I would just request Noor to remind me when I have a few minutes left because I'm not keeping track of time. So, Al Jalila Children's Foundation, what they did is that they took the same program without further investing in the technology itself, and they took it to third world countries in Africa. It was something extremely magical to experience it there. And of course, the benefits are significantly measurable. If you can imagine that a technology is so impactful in our part in a significantly developed world and in a city like Dubai, then how much the impact will be in a third world country. Now, further on the future expansion of the same program, after Al Jalila Foundation, the same program was adapted by the Emirates Airline Foundation and GEMS Education, and all of these different foundation took the same program in different parts of the world, and it expanded further more. Now, important to know what happens. I mean, it's going to be a continuous discussion about the value of innovation. What is going to happen if we lay back and we forget about innovation and we don't even think about it and keep our mind close to it? First of all, um, inefficient processes in training cycles, outdated methodologies. According to World Health Organization, by 2030, that is just 5 years ahead of now, the world, the entire world, will be short of 30 million healthcare providers. So if we need to accelerate in the work in the amount of workforce, how are we going to do that if we keep ourselves outdated? Number two, lack of engagement. See, conventional or the issue, the way that we were educating patients so far with brochures is becoming outdated. Many people are getting their education over Google, over Instagram and Snapchat, and nowadays. So I think as healthcare professionals, it is our responsibility to even, to some degree, have our role in innovation to regulate the entire process of medical education through unrecognized channels. Any organization that is missing on innovation is missing on opportunities, and over time that is going to lead to increase in cost, of course, and the entire organization, the workforce of the organization, the management and everyone will be the new generation. So it is all very natural to move with the stream of innovation. Lastly, this is my last slide. Innovation is only a reflection of our love for humanity. Because when we love our work, this is my own personal experience. As much as I love my practice in healthcare, I am always compelled to find and explore new ways to innovate and improve my own services to the patient. So this comes to the conclusion. Of course, the process, the slides will continue because this is the process of how the VR content development we can discuss later or in the Q&A. And feel free to connect with me on LinkedIn, and I look forward to joining the question sessions if for further discussion. And thank you very much for the opportunity.
Thank you, Dr. Sana. This was very interesting and inspiring discussion on how immersive technologies are revolutionizing the healthcare and medical education. I believe that your session and Dr. Miriam's session has demonstrated a lot on the AI and emerging technologies and how it's not just enhancing healthcare, but how it's redefining the whole ecosystem. And we're very proud to see a lot of the efforts and works that you've been doing alongside with others and how it's shaping and driving innovation in Saudi Arabia to set a new global standard. So with that, we conclude the scientific session 6, and we're transitioning into the next segment. I will hand it over to Dr. Asma, and we'll connect again for the panel discussion.
Thank you very much, Dr. Sana and Noor. So with that, we just concluded sessions in which we presented two of our AI innovators who we're very proud to highlight, Saudi innovators who have developed their innovations to the level of marketing. So this mature stage is very inspiring. And we move on to the next session now, which is to the administrators of hospitals who will be considering applying these innovations in their hospitals. So we start off with the innovators and we finish off with the administrators. Our first administrator is Dr. Arif Omar, who will be talking to us about how AI is shaping private practice in dentistry. Dr. Arif is a consultant prosthodontist and head of the department at Della Hospitals. He has over 3 years of experience as a clinical instructor at Princess Noura University and advanced experience in the private sector. He is a passionate advocate for integrating technology in dental practice and enhancement of patient care in the private sector. He is also a regular speaker at national conferences and teaching institutes, sharing his insights on best practices and the future in dentistry and private practice. So we're happy to hear about his experience on implementing an AI system in their department. Dr. Arif, please, can you share?
Hello. Yes. Hello, Prof. Asma, and I'm very grateful and thankful for the opportunity to be among the very well organized and amazing symposium held for the 4th year. I'm just gonna try and share my presentation. Okay, I hope it's clear for everyone.
Yes, it's clear.
Perfect. All right. So as Prof. Asma has kindly introduced me, I'm very thankful for a very nice introduction. For today's presentation, I'll be discussing what we had, implemented, or we're actually in the trial phase, and we're happy to actually move forward from the trial phase and begin actually full implementation in our department, in the dental department, in regards to integrating AI in our daily practice. It's a bit of a long presentation, but I'm gonna try my best to squeeze it in as much as possible with the main points, so everyone would understand. And I know and I understand that probably some terms or terminologies are dental, but I'm gonna try my best to go through it in a very simplified manner. Okay, so if we start out with the content, I'm gonna kindly go through a bit of AI in the history. We're gonna go through a deep learning process, even though it was discussed as well in the symposium. We're gonna have a hidden struggles in dentistry and what we as clinicians really want to improve in implementing AI. We're going to have the current solutions that we are having, or we have in Dalla Hospital. We're going to go through the specialities, the future in AI, and we're going to conclude that finally with the end of the presentation. A bit of just a quick intro. I graduated from University of Edinburgh 2019, and I did a fellowship in prosthodontics as well, rehabilitation for an extra year, and then I came back to Saudi Arabia afterwards. I also have a special interest in education, private practice, and management, including the new AI solutions and Princess Noor University and other academic institutes. Okay, so let's go ahead and start. So artificial intelligence, actually, back in the 1950s, they had somewhat of a vision or an idea that sooner or later we as humans are going to speak to machines, and this actually happened. We do actually now speak to machines, if you think about it, and this was a quote by Alan Turing in the 1950s. This is basically how it was at the beginning. It was I think the first time they implemented something of an AI concept was with an XO kind of idea. So as clinicians, what do we, or as dentists, let's say, what do we really want to have? We want to have minimum or no missed caries. We don't want to have any delayed diagnoses in our practice or the patients that are coming. We don't want to have any guesswork. We're just focused on precision, and we want patients to trust the diagnosis instantly. So if we're going to go through the deep learning process, and I'm just going to go through it quickly. So we're going to have the data acquisition. We're going to go through the data labeling, data processing, the model training, and then the model testing. And then it's a loop, so it will go back again for the reinforced learning for the system. Deep learning is basically, as you know, simplified in this paragraph is, diagram. You have an apple. Deep learning process will do the cycle, and then it will basically give you, is it an apple or not an apple? We do have some issues. Obviously, if you see here, sometimes it's a bit difficult for AI to differentiate between a Chihuahua and a cupcake, and the floor mat and a Commodore. So this was funny, and I thought I would just put it there because it's not something that is perfect or 100%. So the hidden struggles that we're finding in dentistry nowadays. Let's start out with actually the human to the computer vision. Now, the human eye probably would go a bit higher than just 50 shades of gray. I think it reached up to 100, 150. But in any case, we still have the computer having a higher higher number. It's reaching more than 250, might reach more than that. So basically, will AI actually help us in these manners? Give us more accurate diagnostics? Will it make the manual assessments or the medical reports and all this faster? Will it help alleviate or decrease the patient complaints for us in a hospital? This is just a quick example. We have, for instance, x-rays, bite wings, periapicals that we do on a daily basis. And sometimes, depending on the dentist, they might miss something as simple as a decay, superficial decay on a tooth. With AI, this is going to help us a lot to make sure or give us confidence that, yes, it is a decay. We also have, especially the pediatrics dentistry or the specialty, they face this on an everyday basis where they take an OPG X-ray with the transition between the permanent and the primary teeth. It makes a bit difficult, especially if you have patient after patient after patient. So it's a bit tiring as well. So is going to help a lot in this aspect. All right, so the solution. So what have we done in Della? For us, Della Hospital, part of the Della Health, we're happy to be the first department actually to implement AI in the dental department. So it hasn't been still initiated or started in other departments. It's ongoing and in the process. But for us now, in Della Nakhil, we have implemented it and we're full on using the system. Thakamed have done a beautiful collaboration with us in Della and have provided some data as well in this presentation in accordance to their research and experience with AI and the hospitals. So the Dental IQ software. Where are we and what have we done in Della Hospital to actually help with the struggles that we've mentioned before? So it enhanced a lot of the diagnostic accuracy. We actually felt, especially with the general practitioners that we have in the department, where they found it to be a lot more faster to generate the problems, the issues, caries diagnosis, the fillings, everything to be very, very well systematic, organized, and at a faster pace. In regards to the treatment plan, treatment planning phase is still under process to me personally, and I feel that the treatment planning aspect of the AI still needs to be worked on. The main focus in Della was actually the diagnostic phase. We have a beautiful intelligent reporting on the system where the patient will, within seconds, have a very unified, very excessive, customizable report that can be sent to him to the application or to the email directly. So this saves us a lot of time as a clinician or as a dentist to actually write the medical reports for the patient, send it to the medical department reporting system, and then they send it to them. We also have a comprehensive analysis for what we're doing as clinicians and dentists. So what are the key benefits? We had, just to summarize it quickly, we have an accurate and early detection for the initial month or the initial patients that we started. We had approximately 800 patients and successfully detected 257 patients that had caries. Like I mentioned, we have an efficient and time saving in our reporting and diagnostic on a daily basis. These are just an example or some, just give an idea of how much we are saving time on a daily dental work. We have the initial data collection, Previously, it has to be from 5 to 20 minutes. Now it's around a minute to 2. Clinical examination, not just a radiographic, but in general, it came down to approximately 5 to 10 minutes, I would say, not to 2 to 3. This is just an average or like an assumption. 20 minutes to analyze, diagnose. So mostly it cut a lot of time for us, especially in the end with patient communication, where you would have to excessively sit down and discuss with the patient. It cut down to 5 to 8 minutes. Intelligent treatment planning and reporting, as I mentioned, it can be personalized for the patient. The patient knows exactly where to be referred to, what issues he has, what specialties he has to visit. In regards to really what we want to further develop is that as soon as the patient's medical history is initiated, started, entered into the system, we want to have a full-on process for the AI diagnostic to combine also all the elements from a dental side and a medical side to enhance the patient care. And this is something we're working on with the company right now. We have standardized and consistency to a level, I wouldn't say 100%, but at least higher than 95%. This is also another aspect where we've had statistics done previously. Any X-ray done, OPG or periapical, we wouldn't have actual hands-on statistics of what's happening in the department or at the hospital. This is just some statistics out of the 275 that we have started fully seen at the AI at the department, and some of the numbers that we have in different specialties. I'm just gonna fast forward a little bit, not to just because of the time. And I would like to know as well if there's any, how much time is left by the panelists, please. So
You still have 7 minutes, doctor.
7 minutes, perfect. All right, good. The compliance documentation, it's automated documentation for hospital audits, regulatory standards, especially if the hospital goes into the GCI or Sabahi. I think later on as well, they will join the AI trend, let's say. We need to ensure always to local international medical guidelines. This may also give us some restrictions. It reduces medical legal risks by providing clear diagnostic records. This will help the clinician as well and strengthen the quality control with standardized AI-generated reports. I forgot to add this, but it also would help or will help as well in the future with insurance companies. So this is just a quick example of how the report would be generated to the patient. Very detailed, precise, gives all the information that a patient would really need. Okay, and yeah, patient improved communication. So ignore the actual translation in Arabic, but this is just an example of where we want to actually reach when we're discussing with the patient or communicating with the patient, or even the patient having a full-on report that's AI generated. So what about the specialities? I kind of went through the specialities a little bit to just give you an idea as well. We have the general anatomy as well, obviously, when we do the x-rays in the department for 2D or 3Ds, and it actually enhances an idea for us as well if we're gonna discuss the TMG for instance, for the patient. Does he have any condylar issues, any abnormalities in the bone or the jaw? These things have made it a lot easier for us. This is also another example of CBCT cone beam that was done in department and analyzed by the AI. Okay, What about the periodontics or the gum diseases or the bone diseases that are in the oral cavity? It really gave us an enhancement, and I think the software, if you're going to grade which specialty has the most advanced data, I think it would be the perio, because you have a measurable bone loss that is happening in general to the patient. So it gave us a really good idea and of specifically diagnosing what perio diseases the patient has. These are just some scientific reports on the same thing that we're discussing. We have the AI basically automatically diagnose periodontal bone loss and stage the periodontitis, which, as you know, sometimes takes some time from a clinician to write in a medical report or to diagnose. Also, deep learning has as effectively also went into how much the third molar extractions would be difficult for the clinician. And they've taken some aspects, the depth of the third molar, the angulation of it, and all that. This will also help the surgeon, oral surgeon or maxillofacial surgeon with the data analysis to actually quantitative diagnosis of this. In endodontics, we all know there's lots of issues with the obturation that might happen of the canal, or the fillings, or the leakage that might happen of the caries. So it also helps to accurately detect any lesions or initial lesions that are happening post root canal or for primary to endo. Orthodontics, for those who are, orthodontists, they know the difficulty of cephalometric landmark and detection. Early in the days, especially when we were in dental school, we used to do it manually, take it from the OPG and the cephalo and start calculating, and it wasn't hassle. Now with the AI, it's made it a lot easier. For the prosthodontics, which is my specialty, we really have to work more on a lot of things, especially the implants, the crowns. All these aspects need a little bit more, way to how to utilize the AI to help us, especially with, for instance, someone who's doing implants outside and coming to the hospital. We have different types of implants, around 3,000 implants all around the world. So it's going to help a lot to pinpoint exactly what the implants are. I did a quick poll on my Instagram page where I asked the question: would you feel comfortable working on an AI-generated prosthodontic treatment plan? And these were the answers. So 62% of the people that I have on social media basically are still not really confident to let AI do the actual treatment plan prosthodontically. Now in pediatric, the pediatric dentistry, tooth detection and numbering is very as well a thing that I think every pediatric dentist might have difficulty in. Caries detection as well. I looked into the data and I found that AI still has some kind of struggle with the numbering system. So we have double numbered of teeth in these x-rays. The results for many or multiple data and research saw that Diagnostic Incorporation is one of the companies correctly identified the deciduous and permanent teeth in 58 cases. Errors occurred in 20 cases. So we still have errors in detection, especially in the primary or the pediatric patients.
Excuse me, doctor. We're running out of time. Can we finalize the
Yes, definitely. I'm just gonna so what do we want to do in the future? Basically, for us in Dalla and Thakamed, we are planning to actually make it more and more efficient for the patient and the patient's care using AI in all specialties in the hospital. We want to have good interpretation in between the patient side and the clinician and the dental side. In conclusion, I'm just going to go through the conclusion real quick. So AI is beginning to transform the dental practice, and we've noted the things that really helped us out since before AI and after AI. In Della, we are taking the first steps towards a data-driven approach in patient care. We want to achieve higher accuracy in less time with higher consistency in all aspects. More effective care will result from dentists using AI, and we see that, inshallah, being implemented all over the hospitals in Saudi, and ultimately improving the patient outcomes. Now, what we really want to achieve in the end of the day is the 5 pillars: high data fidelity, risk-based approach, avoid preventable illnesses, better care, educated patients in healthcare in general, not just in dentistry. These are just quick references, and this is my account, Instagram, if you want to message me on anything. And thank you to Thikamed as well for the collaboration. Thank you.
Thank you very much, Dr. Arif. Unfortunately, we don't have time for questions, but Dr. Arif will be available, inshallah, in the breakout rooms, which will start at 2:55. If anybody has any questions for him, please join him in the breakout room. I certainly will. I have many, many questions about your experience in implementation. Thank you very much.
Thank you.
Next to our next speaker, Dr. Arif, if you can stop sharing so Ms. Najla can share her screen.
Yeah, definitely.
Our next speaker is an esteemed innovation leader, well known in the country, Ms. Najla Katib. She has 20 years of experience in numerous institutions. She is currently working at the Ministry of Health, but she has experience at top organizations like Rajhi Bank, King Abdullah Medical City, and as well as the Ministry of Health, where she is now working as the director of the Innovation Center. She was responsible for establishing and executing the strategy roadmap for the health clusters and the 2 medical cities of the Ministry of Health. She trained more than 60 innovation officers and provided mentorship for over 450 entrepreneurs and investors. Her expertise extends to facilitating and conducting workshops for the leadership and executives of the Ministry of Health. She has designed and carried out more than 10 innovation events and launched annual Ministry of Health Innovation Awards. She has signed more than 50 collaborations with private and governmental entities, including SABIC, STC, and Abdul Latif Jameel. Ms. Najla has the privilege to serve as the head of innovation in the Hajj Committee at the Ministry of Health and as a member of the SABIC National Local Content Enhancement Program. She received her MBA focused on international business from the University of Portsmouth, UK in 2006. And today she will be talking to us about navigating healthcare innovation as an executive in the Ministry of Health. So please welcome Ms. Najla Katib.
Thank you. Thank you very much, Professor Asma, and everyone. I'm very happy and glad to be here among everyone and for providing this great an opportunity to share the governmental or the policymaker, let's say, perspective. So good afternoon, everyone. As Professor Asma said, we will navigate the healthcare innovation, but from the lens or the eye of, let's say, the governmental sector, where we get into a deep, let's say, understanding of the current situation, what is the reality of the industry in general, and what is the challenges that we are facing, and how can we overcome them with innovative strategies, and what are also the opportunities for us to innovate in healthcare in Saudi Arabia. So before starting or navigating more about innovation in healthcare in Saudi Arabia, I just want to give a quick, let's say, brief and about the history or about the rapidly changed ecosystem that is happening in healthcare, or what has been happening through the 8 years since the Vision 2030 has been launched and announced. The health sector transformation, let's say, transformation office or program has been launched in 2016. And that transformational, let's say, vision has changed a lot in the healthcare system or in the healthcare sector in Saudi Arabia. For example, a lots of new entities came into market, more of a specialized entities in healthcare for special roles and responsibility, patient safety, وقاية, برنامج التحول or the transformation program itself. But I would sum all these changes in a very nutshell, let's say, words, where what I say before the vision or before the transformation in MOH or in the healthcare, MOH or the Ministry of Health in Saudi Arabia were wearing all the hats and taking all the responsibility and roles in the from all perspective. They were the service providers, they were the payer, and they were the regulator and policymaker. Now or today, let's say, it is totally different after establishing or changing or changing the hats or the responsibilities with the new entities coming to the market. So we have the Ministry of Health as the main regulator for the healthcare sector. They are the policymaker, and this is what we are dealing with right now. We haven't completed our journey yet, but this is what we are doing, where the payers are separate than the Ministry of Health, and also the service providing the service and operational part will be under the health holding company and the clusters in the kingdom. Of course, this shaped our objectives in general, empowering coming from the Vision 2030 objectives. So we need to improve livability in Saudi cities, improve quality of service provided in Saudi cities as well, facilitating access to healthcare services, improving quality and efficiency of healthcare services, promoting prevention of health risk, and also enhancing traffic safety. So if we want to, let's say, define innovation in healthcare, or what is innovation from the, let's say, Ministry of Health perspective, it's the application of new ideas, technologies, process to improve healthcare outcomes. It can range from digital healthcare solution to, like our subject or topic today, to a new treatment and methodologies. It's aimed to enhance the patient care, improve efficiency, and reduce cost. It is, of course, important because we are going into an aging population and raising healthcare cost demand, innovative solution. New technologies like AI and genomic offer personalized treatment option. Patients expect more accessible and efficient health care system. In healthcare, the healthcare landscape is evolving rapidly, as I explained earlier, reducing, emphasizing the constant need for innovation in healthcare. So how will we explore today in this? Many options or opportunities for that. We have the digital health, telemedicine, AI-driven diagnostic, and mobile health apps. For example, I would just go through each of them and try to pick on the real, let's say, current state example. For example, the mobile health, either from the private sectors or even from the Ministry of Health, we have Sahati app, where now you can reach to it. You have all your numbers in one single single platform. We have launched also in Health Global the digital twin, where you can compare your data, your health, your numbers with reality, with the optimum, let's say, result or health for your age. Personalized medicine also is another opportunity where it is driven by AI, and how can it يعني find a better situation, better solutions for patient. Value-based care, shifting from fee to service to patient outcome-based resilient models. AI automation in imaging and also diagnosing and privacy analytics, blockchain and data. And we have seen great, let's say, examples in Corona, and how did Ministry of Health in Saudi Arabia, or Saudi Arabia in general, with all the, let's say, blockchain and communication with everyone, we did great results. So in general, these trends are shaping the future of healthcare. They are the opportunities for innovation. Digital health is expanding also access, while AI and automation is improving accuracy and efficiency. What are the challenges in healthcare innovation? Regulation. It's always appearing to my face every time we have a new idea or a new solution or a new machine that is coming. But again, talking about it today is just to address it and to know that this is a fact and how can we deal with it. It doesn't mean that it exists and we don't have solutions for it. So regulation, compliance with the Saudi FDA or other organization within the system inside Saudi Arabia is very much needed. The integration between the, let's say, the ecosystem, or what we call it, the MOH plus, where all the major or the main players as regulator or operational or service providing are playing within one ecosystem to make this innovations happen on real. So this is very important, and I can tell you that I know this challenge is existing, but again, it's everyone is working on integrating together to have this great innovative ecosystem, inshallah, nowadays and in the future. Cost and ROI concerns. This is also another challenge where every single, let's say, innovator or idea holders comes to the Innovation Center office and they say, how can we have a very clear, let's say, funding channels, or how can we support as Ministry of Health in that? Adoption barriers, the resistance within the culture inside the let's say, the organizations or the people or the change. This is something very natural, where we know is change is always coming with resistance. Overcoming it, as I said earlier, engaging early with the regulatory bodies and having in, let's say, the Innovation Center and the Ministry of Health, or a regulatory, let's say, body within the ministry for overtaking these challenges and discussing and opening the dialogue with all the MOH plus and with the private sector and with everyone in the ecosystem is very important. Integration, of course. We cannot work alone without integrating with everyone and finding solution. We cannot find the best way to overcome these, let's say, challenges. Also, education and training. It's very important for us to have talent inside local talent and train them with all these, let's say, changing that is happening. And of course, we are working in collaboration with the private sector and governmental sectors to enhance that training and education. These, let's say, strategies help minimize risk and ensure smoother adoption process. Collaboration between stakeholders is always, I keep saying this, is always a key to success. Case studies of successful innovation, telemedicine expansion. This is, we've witnessed this through, let's say, a very hard time, COVID-19. A lot of MOH project with the clusters project, came up to help let's say the telemedicine solutions. Also in special seasons like Hajj, wearable technology is very important, where you can monitor a special, let's say, disease or a special patient with a special type of, let's say, diseases. Blockchain, also AI in radiology. These are examples from a real project that has been done through the Ministry of Health, and also they are an opportunities, whether from the private sector or from the, let's say, entrepreneurs. AI-driven healthcare decision-making, advanced robotics, enhancing precision in surgery and patient care, CRISPR, gene editing. I can recall one of our success stories was announced like 2 months ago or 3 months ago for the gene editing for the first patient in Saudi Arabia in CMAIA, and that was considered to be a breakthrough, where we had our first patient in Saudi Arabia. Behind that was a lot of, or maybe all of the above, what we mentioned, of the integration, the communication, the quick response of policymaker regulation. They all had it together in one, let's say, quick dialogue and quick communication together, where they really showed a very great success story for us, and that could be is a great, let's say, chance for us to have it again and again. Healthcare innovation is crucial for improving patient care and reducing costs. Challenges, of course, it exists, but strategic approaches can overcome them, as the examples I just mentioned. Collaboration among stakeholders is essential for successful implementation. So what can we do? This is our, let's say, innovation ambitious matrix in the Innovation Center and Ministry of Health, where how can we have, let's say, a very balanced and, let's say, a portfolio in our healthcare, let's say, innovation system. We need 70% of our innovation and resources focusing on the core innovation business, what we are doing right now, and how can we improve what we are doing right now, whether it's a digital health record, enhancing hospitals workflow, routine service enhancement, telemedicine expansion. I mean, every time we discuss this inside the ministry, and we say, where should we innovate? We find ourselves that we are surrounded with a lots of challenges, operation challenges, a lots of gaps in the system in providing the services itself. So having this, let's say, balanced challenge between improving on working on what we are doing right now, and also giving the space for the future innovation. So 70% is innovating on what we are doing right now, and 20% on what we can do in the near, let's say, future. Examples: wearable health devices.
Excuse me, Ms. Najla.
Yes.
We need to wrap up now.
Yes.
Time is almost finished.
Sure. So wearable health devices, new patient engagement, community health programs, and also specialized clinics. And of course, 10% of innovation resources must be for the future, where we can innovate in AI-driven diagnosis, blockchain for health data security, predictive analysis or analytic for public health, and so on. Of course, we need to do that with a very strong and good management framework where we have everyone in the ecosystem, or for the, let's say, the innovation journey, or to happen to, we have a very clear, let's say, pipeline management and steps, internal and ecosystem processes in general. Of course, the benefit of an innovation portfolio could be unified strategy, balanced growth, resource optimization, enhanced collaboration, and also improve public health outcomes. Thank you very much, and thank you for your time.
Thank you very much, Ms. Najla. That was a very clear and concise overview of the ministry's goals and objectives in the near and distant future. We really appreciate hearing about that. I'm sure it's going to be very useful to all the innovators out there who hope that one day the ministry will adopt their innovations. Next, we move to our other administrator, Professor Ahmed Hirsi. We're glad he's. Are you here, Professor Ahmed?
Yes.
Okay, great. Wa alaikum assalam. You can share your screen now. Professor
Mashallah.
Ahmed Hirsi will be kindly speaking to us as about the approach of the King Saud University Medical City for evaluation and deployment of innovative AI solutions in the medical city. Professor Ahmed Hirsi is a professor of medicine and a consultant electrophysiologist. He is the chief executive officer at King Saud University Medical City. He obtained his MBA in International Healthcare Management in 2017. He was also honored to be selected as one of the top 101 CEOs of academic medical centers worldwide by the Becker's Hospital Review in June 2023. A prolific investigator, Professor Hirsi has authored or co-authored numerous original and review articles, with his work appearing in leading journals such as the Journal of the American Medical Association, Circulation, European Heart Journal, Canadian Journal of Cardiology, Clinical Cardiology, Journal of Cardiovascular Electrophysiology, and the Saudi Medical Journal. He is a reviewer for the Annals of Saudi Medicine and the Journal of the Saudi Heart Association. He is also a fellow of the Royal College of Physicians and Surgeons of Canada and a member of the College of Physicians and Surgeons of Alberta, the American College of Cardiology, the Canadian Cardiovascular Society, and the American Heart Association. He is currently a member of the Saudi FDA Pharmacovigilance Committee and of the National Cardiology Training Board. So we're very pleased to hear about the KSU Medical City's approach and assessment of innovations prior to their implementation.
So thank you.
The floor is yours.
Thank you so much, Dr. Asma, and I'm really glad and honored to be with you here today to share some of our early steps in establishing an AI unit, and then our framework to go about this very important topic. So, okay, so here is the outline. So can you hear me, Doctora?
Yes, we hear you clearly.
Thank you so much. So the outline of my talk will mainly focus in 3 points. The first one is why evaluation matter. Why do we have to evaluate any solution? Because that's quite important to have clarity around this point before you adapt any AI solution. I'm sure most of the administrator in hospital, they're bombarded with multiple solutions every day through their emails to solve multiple issues in the healthcare system. Then we will share our 6 steps model, and we will focus on the maturity assessment for adoption of AI in healthcare setting. We use the SMAIA published metrics, which is a survey that the institution conducts, then it boxes the maturity into 4 areas, and I'll show you the slide in detail how we went about this, which really guided us to where to invest most of our time and energy in terms of preparing the institution for AI, safe and responsible adoption of AI. Then I'll go about how AI should be responsibly deployed in healthcare setting. So this will be very practical steps that if any institution decide to responsibly deploy AI should follow, whether it's and it's based on CMAIA, on some of the literature, on some of the SDA approved, Saudi FDA approved guideline, as well as the national governance model, the OECD models for responsible and ethical deployment of the AI solutions. And finally, as any new solution or any new technology, there is challenges in most of the institutions to deal with, and they have to make some trade-off in adapting these solutions, as well as the timeline that we have adopted. So why evaluation matter? There is a high risk for failure in any technology adoption, whether it's EMR, new EMR system, whether it's like enterprise solution like SAP, or any technological deployment in any hospital. It has a very high risk for success, for failure. Nature Digital Medicine quoted that 60% of AI tool fails clinical validation due inadequate pre-implementation testing. So there is the deploying a new solution. It requires not only buying the solution, but there is a lot of preparation, especially change management, adoption, dealing with resistance, having buy-in from stakeholder. That's most of the challenges comes in, and might lead to failure of any adoption. Cost overrun, most of the, based on the Gartner review, 57% of AI projects fail due to a rushed adoption. So if you rush it, you can buy the solution, you want to implement it, but if you don't really take all the stakeholders buy in, they might not really use it because it might add new steps to the work flow, and it's not really well integrated and thought of process. And the third point, we know the case study of IBM Watson. They designed a very sophisticated solution for oncology patient. Unfortunately, today, it's not used because they designed a solution before looking at problem, and that's one of the main strategical decision that every institution should make. You should not buy the hammer first because it's available. You should not buy a solution because it's you get multiple emails with fancy solutions, but you might not need it because this problem is not pertinent to your context. Key benefit, absolutely. AI is in the front and center for any medical institution. It has a lot of benefits. 70% of the companies use AI in some sort to streamline businesses, or to decrease cost, or to say or predict occurrence of event, whether it is sepsis like in the ICU, or prediction of long-term incidence of certain diseases. Extremely important. 39% of healthcare leaders plan to invest in AI for outcome prediction. And this is, I think, in my mind, is underestimated. There's multiple other publications showed higher number of this. There's a very big hype in the medical arena when it comes to AI. Everybody wants to deploy, implement, buy AI solution, or develop AI solution in healthcare. Some report says that it will save money up to $200 to $360 billion in the US healthcare system. Those are promises based on consultants' reports and prediction models, as well as forecasting. There is also risks of misaligning workflow. Clinician can be burned out. So if you apply a new AI model without involvement of all the stakeholders in the planning and adjusting their workflow, they might not use it. There might be big resistance, or there is a risk also quoted in the literature of automation bias. You can find this coined in one of the New England Medicine Journal, that it might lead to decrease the ability of physicians, especially trainees, in recognizing certain health conditions. And that's been the case with multiple technologies. If you can remember, 20, 30 years ago, we used to memorize all the phone numbers of our relatives, friends. Today, I don't memorize. I don't know the phone number of my son or wife. I don't memorize them because the technology helps us this. But when it comes to healthcare and training, that might be really a problematic that we should consider this as potential risk. Biased algorithms, inequitable care. In one of my speech in the past, I gave the example of a model that was developed in pregnant women for detecting breast cancer in cosmopolitan Boston area. When it was the prediction was extremely better than human, but when this is applied to Chinese or Eastern population, which was not represented in this population, this showed that the model did not perform as well. So most of these models that were developed in other setting need to be validated, at least in the Saudi population, to make sure that we capture the same and reap the same benefit from this model's predictions. Legal and ethical concern. As a health administrator, it's extremely very important to me before we deploy any solution to make sure that all these legal and ethical issues are ironed out, and especially when it comes to integrating AI solution in caring patients, in delivering care. It's not a secret that most of the regulatory bodies in the world, they're struggling with, and they're really behind the technology. The technology is so advanced that the regulator cannot catch up in regulating what should happen if a mishap do occur. For example, if we integrate a solution and this solution leads to some sort of wrong prediction, wrong diagnosis of a patient, and this is used by a physician, so who is liable? Is it the institution that adopted this AI algorithm and did not make sure that it's supposed to do what it's supposed to do in terms of updating it and making sure that there is a validation in process in this institution? Or is it the physician who will be liable, or is it the vendor who sold this solution to the hospital? So that is still, there is no answer who's liable in this setting. Vision 2030, we have to align. So definitely AI must be enhance quality of care, efficiency, and so the leadership and medtechs also, all of them, they advocate for using it. So we cannot come to the game late. So we have to adapt it cautiously and recognizing its potential benefits as well as risk. This is the model we use, and I'll go over this in detail in the coming slides. So it's a six-step model. The first step is we assess the maturity of the institution in terms of the data, the leadership, the manpower, as well as the governance framework that exists in the institution. And we use the CMAIA framework. Then we put a strategy in place. I cannot overemphasize the importance of strategy. With this hype, without a shared understanding of what AI should achieve at any institution, and KSUMC, project can easily become disjointed, lose focus, ultimately fail to deliver any real value to the patient. And they, as I said in the beginning, they're very expensive. They're very expensive to deploy. They're very expensive to monitor, and there's also a risk. So if we're not sure what we want, as if we're going to buy a hammer before we look for a problem to solve in this case. Operational model, it includes 3 steps. One is the governance framework for AI. Second is end-to-end solution to the development or deployment of the AI. And the third, it talks about the manpower and the processes and policies. Then stakeholder buy-in and the importance of engagement. Not only physician, clinician, also the administrator need to buy in. And then at later stage, patients should know ethically that AI was used somehow, somewhere during their care process, and they have to, whether they have to consent to that or not, that's something that need to be figured out in the future by the government framework. At the end, after you sort out all these things, is piloting and testing, and finally upscaling or go no go decision in any solution that you acquire. So AI maturity assessment. There's key priorities and institutional readiness. So first one, it talks about the leadership understanding of AI. And believe me, if the leadership, top leader is not convinced, not only in Saudi, all the publication by BCG and other consultant, they said this is a big failure in terms of deployment and uptake of the technology in the institution. So what we did, all of our leadership, all of our executive are certified in AI by either MIT courses or Harvard courses, which is about 6-8 weeks. Then we did leadership courses with CMAIA to go over some of the important data management and governance issues in our institution. So that's done in our institution. Strategic alignment, to have very crystal clear strategy as to where and how we're going to use AI in our institution, which I cannot overemphasize this. This is the most important, I think, and I'll show it at the end of the conclusion messages that I have. You have to know what do you want, because this is you get bombarded with multiple solutions. So if you don't know what you want, you will be definitely lost. The second point is data readiness. It talks about assessing the availability, the quality, the compliance of patient data with a national framework. And this is one of the toughest point. And we're working on our data warehouse cleaning, aligning data. Some of the data are in silos. So this is going to take some time, but we embarked on this as well. The third one is human capability, and CMAIA has a human capability program. We almost, with other colleagues in other departments in the hospital, as well as other colleges, we certified more than 150 in terms of AI upskilling and AI literacy. We conducted this in the last month. Also, the hospital conducted with a vendor about training about 300 nurses with a vendor from Dubai to upskill them with respect to AI literacy. So that's work in progress. We're planning to certify and train more than at least 10% of the hospital in the coming year in 2025. But always there is a need to update yourself as well as the staff and make sure they buy in and they are well acquainted with their skills that they need to deal with AI. In terms of the administrative, there is a good courses in CMAIA, which is a national platform. We enforced that all the employee in KSU MC have to be certified by CMAIA, and this will be part of their annual evaluation. So it's not only the hospital not only the healthcare worker, the hospital administration, also they have to be savvy, AI savvy in terms of making sure that they have AI literacy. The third one is the technology. And this also talks about assessing the readiness of your infrastructure. Clear understanding that your infrastructure is that you need is in place, all the resources, the IT system, whether it's hardware or softwares or networks, can support any solution or can support that you acquire, or also can support any solution development in the institution. That is a work in progress. Definitely our IT system is up to date, but we don't have supercomputers that needed to be in place to help in developing this algorithm. But we can collaborate with like our ecosystem, like the engineering, the IT colleges to maybe help with these issues. But that's definitely something that CMAIA requires and assess in any institution. And the last is governance piece. And I will talk in detail about the governance when we come to the operation framework. We have all the policies, procedure, structure, committees, term of references that needed to be in place to make sure that there is a safe and responsible deployment of AI solution in the institution. At the end, when you tally all the numbers that you, which is 1 to 5 in each domains, you can box your institution in one of those boxes, either emerging, AI maturity, developing, proficient, or advanced. We fall in the developing category after we did our assessment. So a developing entity that recognizes area for growth and is planning to implement initiatives focused on effectively adopting AI. So that's our assessment. So the first step is, where are we from in this spectrum? Then the second most important step is to have a crystal clear strategy, and you assess the needs in the institution and have a vision and a mission. What do we want to do with AI? And that's you define problems, then you go and acquire or develop solutions. The wrong approach would be if you acquire solutions without knowing how you're going to use it, because you will be bombarded with the amount of solutions that are available to you in the market. A strategy also has to align with our strategy, the KSUMC strategy, with the nation strategy, as well as with CMAIA strategy, which mainly talks about enhancing operation efficiency and and quality of care, promoting ethical and responsible deployment. All this is emphasized in this narrative of CMAIA's adoption framework, supporting the Saudi vision transformation. So this is the most important thing. Define problem, not chasing solution. If I can get this point across, I'll be very happy. So because I've been every day get 6-7 emails with solutions. So identify specific clinical or operational challenges, then you can develop solutions or acquire solutions that can help you help you solve this. You have to have strategic key objectives in your strategy. Either it's improving patient care, reducing medical error. This is one of the research projects that one of our colleagues is working on. We have a huge data in our mortality and morbidity data sets over the last 10 or 15 years. We can maybe, if we can develop an AI algorithm, he's working on this project to detect a pattern in this medical errors or mortality error, morbidity reports, and see how we can prevent further occurrence of this medical errors or mistakes. Enhanced workflow efficiency is very redundant, it's very broad. You can apply this to every department in the hospital, from the emergency room to the ICU to supply chain to HR. So, but do we need that? Do you need an AI solution to do that, or is there any cheaper solutions, easier solution to deploy to solve that? So there is solutions in the market to do this. There is solution to optimize supply chain. There is a solution to help in clinical decision support, but you need to make sure that they are validated, they work in your context, they can predict the same, they can give the same results in your population. For research and innovation, definitely, it's a very green field in our country as well as in our healthcare system. We can deploy AI and develop whether develop algorithm to help or deploy AI in streamlining and helping us, for example, in the clinical trial unit in selecting patients or shortening some of the processes in our clinical trial unit. So one of the key objectives in the strategy is to ensure ethical and responsible AI use by developing guideline, policy, process, and I will talk about that in the operation model. This is extremely important because the liability and responsibility at the end of the day falls on the administration of the hospital. If somebody uses AI without a proper channel of governance and deployment, at the end of the day, the hospital administration are responsible in front of the patient and in front of the law. This is just to, I'm not going to read this, but this is the group of questions or solutions that are available out there. From patient, clinical, provider, management, there's tons of solutions out there. If you don't have a clear strategy of what you want, it's like taking your child to the store to buy a toy, and he will grab everything is available there. So number 3 in the steps is operational model. And the operational model has 3 steps. Number 1 is AI delivery. So you have to map end-to-end delivery process to manage AI project within your institution, and clearly articulate who's responsible, what are the deliverables in this stage, what are the KPI, what are the how success look like. Number two, AI governance. And governance, I mean by governance here, a body or committees or teams. They have to be very well structured with very clear reporting matrix. And finally, AI organization setup. There has to be an entity that owns this AI in the hospital or in the institution. So this will give it more ownership, and things will not be fall through the crack by not having a clear reporting and clear ownership body. This is an example of AI delivery process where you say there should be ideation, and in the ideation, for example, you talk identify a business need, write a case use clearly. This is an activity in ideation. Then the deliverable could be file out a standardized use case template, which I will show in the next slide. Then the next step would be the collecting. You collect use cases, you prioritize them. The deliverable could be a portfolio of prioritized use cases within the hospital or the business. And the third step will be pre-development. You talk about the activity would be test the concept and proof of concept, and the deliverable would be use case, proof of concept, and plan for further development. In the development, the activity could be develop a market need or a hospital need or service need, and the deliverable will be ready to scale or not to scale. And the final point would be readiness to scale it in the institution, deploy, operate, make sure that everybody is involved, are aware of this. This is an activity, and deliverable will be performance reports. So you deployed it, then you have to measure performance. There was a paper in New England Journal, is a call for action. And in that paper, they say there is no entity that looks at the performance of these this AI solutions out there. How do they perform in real life? There is no follow-up. There is a need to establish centers in the hospitals or in other to monitor the performance and give a feedback on update. This is the framework to prioritize, and it uses two metrics. One of them is this is simple, easy to apply. The risk is low. This is maybe a priority. If the risk is high in deployment, there's some issues with the liability, or there is no enough people or talent to deploy this, or the platform is not very mature, then this might not be a priority. So there is a matrix that you use to prioritize your solution. For example, using AI solution in the clinic for using transcription of the conversation with the patient, that's a low risk event, low risk setting. But if you want to use it in the clinical setting, clinical care, that can be a high risk setting. Likewise, if you want to use it in the HR or supply chain, that could be a very low risk setting. This is the template we use and developed for a use case. So everybody have to bring this in. If you want to develop a use case, what are the challenge, what you're solving for, describe the use case, what is the risk, key success metrics, data requirement, approach, then other requirement in terms of the resources. I think I'm very late. صح يا أسماء؟ طولت عليكم.
خذ راحتك,
Okay.
Professor.
I'm sorry, والله.
I've already gotten the permission of the panelists after you, because this information is extremely important for all innovators and researchers in AI. Because like you said, what's the point of us working and developing things if they don't fall within the strategic aims of our targets?
Right. Okay. Thank you so much. So this is the governance piece. And when we say governance, we don't mean only the committee or the council. It could be teams. It could be a team of teams, small teams that need to be formed. It need to address at the organization level, a structure, as well as a body that oversees the whole process. And the aim is to define and validate strategic objective. It could be at the hospital level. Number one, it could be a roadmap approval, how to communicate, who has the check and balances there. AI use case has to be governed. So if somebody reports, if he submit an AI use case, Who's to say this is a go or no go? This is good or no good? There has to be a committee that has a term of reference, and they submit their report to be fair and transparent to the council. The council will have the final say. So all these metrics to provide a clear and transparent process of developing and allowing people to flourish and come and even research it. They have to have access to this, but all this has to be governed, because data sensitivity is a big issue, and this is in terms of research. In terms of deployment, the risk and liability at the end of the day falls on the hospital administration. This is just the organization setup. This is the body. The previous one was policies, procedure. This is the body. We have established a head unit. We made sure that it's small. We don't want to call it center of excellence. It's a big name, but then there's nothing. There is no outcome. We want to call it it should be very small, 3 people, and then it will grow naturally, hopefully with time. So we have a lead or a champion who leads this, which is Professor Tariq Kashour, who reports to the executive administrator for research and an academic, Professor Majid Al-Madi, and they report to the council, which governs the ultimate governor in the hospital. And we have three functional 3 areas. We have AI project management team. They oversee planning, execution, delivery of the project, and collaborate with product owner. And then the data scientist, prompt engineer, their main issue is the data management, and that in that area now we're in the process of hiring a data scientist, and this is one of the rare or very difficult, hard to fill positions in Saudi. But hopefully, inshallah, we'll find somebody to work on this issue. It's one of the priorities, but there is other maturity issues that we're really busy with. Finally, the ethics and policy and procedure, ethical concerns, and the governance piece, and that's completely finished, alhamdulillah. We have also a small custodian of the ethic under the unit to make sure that all the process, all the use cases, the streamline of the work is ethical and transparent and fair to everybody. So number 3, this shows the scope of the unit. I don't want to go, I can send you the slide, but the scope is AI project identification, prioritization, develop and implement AI solutions, train and support. So it's not enough to say, I want to develop a body. You have to develop a scope of activities so you can hold them accountable and also track their performances. I will skip this. So number 4 is stakeholder buy-in. Clinician and not the end user. If you think about them as end user, you will lose them. You have to make sure you involve them from the get-go. You have to involve them in code designing. This is very important because they're going to use it. If they don't like it, no matter how good and powerful and beneficial is this product, they will not use it. So you have to involve them from the get-go. The clinician in developing, in identifying the problem, in choosing the solution, and in making sure that it flows well in their work flow. Otherwise, they will not use it, because nobody want to use something that is gonna delay his work in the clinic or during the surgery or whatever. The tactics here is to appoint a champion in each department or in each unit, so they own this. They feel them, make them feel that they own this. Then they will definitely be part of the process. In the future, I think patient focus group need to be involved. If I'm a patient, I want to know that AI was involved in my care, or it was just fully a humanized approach to my care. And this might have some legal implication down the road. Okay. Pilot testing, as I said, you have to choose very small, very controlled project, very small, low risk, like the dictation or the transcription project. Design an experiment, make it very small, divide it in one department, and then look at metric of success. Did they make the physician, it could be qualitative or quantitative. It could be just a questionnaire. Are you happy? Do you feel that your work and your clinic are running smoothly? Or it could be more of metrics or quantitative metrics to assess the efficiency and the value that added by this AI solution. Then if there is a failure, you have to deal with it immediately and do failure mode analysis, whether this is very accurate AI solution or not, and before you scale it up. So what we did in our case, I use it in my clinic, only in my clinic. Then if I'm happy and fine tune it, it was a solution that understand Arabic and Saudi dialect. Then we had an issue with the Cerner in terms of integration. I really love the solution. There was an issue with the integration. And then when we solve the issue of integration, we will ask a couple of physicians to use it. If everybody's happy, then we can scale it up. So do not embark on full-fledged solution because from experience, you will fail. Definitely you will fail. Okay. Last but not least is implementation decision. Once you decide, wow, this is the perfect solution that we want to embark on, and we want to scale it up, analyze the pilot, make sure everything is defined very well, consider any long-term impact and resources that are required to upscale it in the institution, and make a data-driven go, no-go decision, and make sure that then you follow up the impact, because some of the promises that AI are giving might not be in the real life the same. You're going to reap the same benefits. There's a very nice paper in AI in New England from Sick Kid Hospital talking about using ultrasound in diagnosing renal problem. And what they found in real life was completely different than the benefit and the value promised during the testing and validation process. So that's also why the other paper called for call for action to find a body that looks at the impact in real life of these solutions and their performances. Okay, challenges. Any technology has challenges, definitely, but you have to know what are those challenges. One of the challenges that we have is data silos. We have a lot of data in multiple places. One of the things that we're working on is to make sure that our data follows the CMAIA data maturity index. The second problem is even if we have a data and it's in one place and we validate the solution in one place, I think we need to test these solutions in multiple centers to have a larger data size that can give us more assurances that this is really a very valid solution. So data federation and having a Saudi data maybe under CMAIA, where it's all healthcare system provide their data, we can use it as a sandbox in under their custodianship. That will help the whole country and the whole system to make sure to validate these solutions in a larger data set. Clinician resistance, as I said, this is have to be taken very seriously. We started to engage them from the get-go. We developed an AI literacy program, either funded by the hospital or through CMAIA, and they have to be really AI savvy. They have to make sure that you have the message out there. This is not to replace you. This is to make your life easy, and make sure that you walk the walk and talk, because otherwise they will not use these solutions. Bias risk, diverse training data set. As I said, they need to be trained in our local data sets. Some of the other challenges is the data quality, the data accessibility, algorithm biases, and fairness. We talked about this. This is always a challenge that has to be kept in mind. Interpretability and transparency of the solutions. Most of those solutions that if you want to acquire them, you don't know how they were developed. You don't know the data set that used to derive or develop this algorithm that you're acquiring. So there is sometimes lack of transparency. How did this come up? How did this reach this stage? Integration with existing system also is a challenge. I give you an example of the dictation, the transcription solution. We had an issue with Cerner. It will be solved, but always you have to think that before you acquire any solution, that all your T's are crossed or your I's are dotted, and so otherwise you're going to be facing some issues in the future. Timeline. 1 to 3 months, establish a unit, governance body. This is easy. You just have to make sure all your ducks are in place, your policies, procedures, your unit, conduct a need assessment. What are the main challenges in the operation that I want to solve for? That's really a key. Then develop a strategic plan. You can do this in 3 months. And this is, again, to overemphasize the point that we're here to solve solutions, not to acquire. We're here to solve problems, not to acquire solution. In the 4 to 9 months, you can set up an infrastructure, recruit additional staff needed for the unit, specialized staff, initiate a pilot project. In 10 to 18 months, implement and monitor pilot AI solution, provide staff training, collect and analyze performance data. In 2 years' time, inshallah, you can evaluate your pilot result, expand successful AI application, identify new initiatives. In our institution, we decided to have only one project, one solution, 2025. We're not going to be overzealous, and then we might fail. Finally, this is my conclusion, and this is the most important one. AI should not be treated as a solution in search for a problem. I think if I leave you with this, I will be extremely happy if I can get this point across. Organization should start by identifying key unmet needs or that the technology is suited to address. The structure implementation plan ensures sustainable and ethical and responsible AI adaptation. Thank you so much.
Thank you very much, Professor Hirsi. That was an extremely informative and useful presentation for all of us in this symposium to know. And before we move on to the panel discussion, in which now we will bring together our two entrepreneurs, CEOs of private companies, and our two administrators, Ustad Najla, Professor Hirsi, for Dr. Noor Al-Saodoun, to ask them additional points on how entrepreneurs and administrators can help each other to improve the usefulness of innovative solutions in the ecosystem. But before I turn over the floor to Noor, Professor Hirsi, I heard you once say a very eye-opening statement, and I'm hoping you can share it with our audience today. When I attended الملتقى اللي أقامته السدايا وجامعة الملك سعود approximately 2 months ago في جامعة الملك سعود, you said something which was like a wake-up call for me as a scientist. What you said, as an administrator, I don't care about the accuracy per se. I let the doctors care about that, because when they suggest something for me, they will suggest something that they know is accurate or is useful for them. For me as an administrator, I care what will help the doctor, not help the patient, because the doctor, the clinician, is the one who is worried about helping the patient. So can you expand on that thought?
I think as again, this underscores the importance of stakeholder. The main stakeholder that we're trying to help here is the physician or the healthcare practitioner who's going to deliver the care. So we should focus on this as our true north, because if we don't involve them, if we don't make them feel that we're solving their problems, they will not adopt it. They will be very resistant to any new solution, no matter what you feel as an administrator, that this is a fancy solution. We have to be early to the game. We have to adopt this, and you want to publicize this. If the people on the ground, the foot soldier, they don't buy this, they don't feel that you're solving their problem, or if they feel that this is a burden on them, this is not going to fly. This is not going to fly.
Thank you very much. And I've had requests for your slides.
Abshir, Doctor. I'll make them available. And this is, we love to share our experiences and help any institution, because at the end of the day, inshallah, our success is their success and vice versa.
Inshallah. So if whoever is interested to receive Professor Hirsi's slides, just send us a follow-up email that you will receive on Zoom, and we will provide you with those slides once we get them, inshallah. With this, now we move on to Noor Al-Saudoun, who will moderate the panel with our 4 distinguished speakers.
يعطيك العافية دكتور أسماء and Professor Ahmed. This was very insightful. بصراحة يعني you've shed the light on many things that needed to be discussed today, and I think this panel discussion fits very well as a transition to your presentation, where we're bringing together the ecosystem players from the leaders, the entrepreneurs, and the policymakers. And with that, I really want to start to shed the light on the reality of AI startups and where we're at when it comes to AI healthcare setup here in Saudi. I believe that we have world-class innovations and solutions, and a lot of significant investment backing us up. But we have seen that many of these solutions have struggled to scale beyond the pilot phase. And maybe I can point to Dr. Mariam and Dr. Sana. From your perspective, why, as a startup leader, why do you think there is a challenge? And what is the biggest challenge that you see that limits you from moving forward with your solution into the market?
Sorry, يعطيك العافية, Dr. Ahmed. It was a great talk. I'll talk about my experience. For me, it was the funding. I'm not going to talk about Precision. Precision was like a project with the university. It well constructed and everything. But when I start my own startup, I struggled a lot with finding the fund. So I'm funded up to date, and also commercializing. Commercializing is really hard, and the hospital engagement is very limited, because this is like a solution I want to try to give a pilot study, and from the pilot study I can later implement it, or let's say validate the result. Because at the end, if there is no validation, no one would know how sure is let's say this product that you are providing is accurate or not. This is from my experience.
Thank you, Dr. Mariam. I hear you, and I struggle with the same issues that you've mentioned, but I also wanted to hear from Dr. Sana, especially that we wanted to know if you think that there is institutional resistance, especially in XR and healthcare.
Well, see, my answer, I think it will be a summary of Dr. Mariam and Professor Ahmed's answer. The challenges are there, just like Dr. Mariam has mentioned: funding, finding the right processes, and then understanding the market and who would be your prospective partners in healthcare. However, now emphasizing on what Professor said, that start small, start the pilot project with one department, with a very small group of activities, and prove the success of that case. Even if there is a failure, keep working on it until you succeed, because that is the only way that we're able to convince the other departments and the rest of the admin for the value of innovation. It's a new world for everyone. It's new for the entrepreneurs. It's also new for the people or the organization who will be adapting it. So the best way to do it is to show them the success.
Interesting. And I hear you, and I hear Dr. Mariam mentioning funding multiple of times. And I wanted to know, maybe Professor Ahmed, you can tell us, why do you think there is lack or insufficient funds? Is it because the startups or the solution are not aligning with the real needs, or there are other disconnect in the ecosystem? Professor Ahmed?
Oh, sorry. I'm sorry. I was muted. So thank you for the question. I think I'm not, first of all, I'm not an entrepreneur, so I cannot comment on the fundraising strategy that Dr. Sadoun and the Dr. Mariam and Dr. Sana have tried. There is multiple funding sources, and but I can understand the difficulties they're going through, because I've been in several meetings with startup companies in AI health, and their struggle is bigger than you can imagine. They have issues with funding, issues with collaboration with the institutions, issues with the risk is high. The risk of failure is really high, and they need a lot of money, and you have to burn some cash. You have to be willing to say, I'm going to fail, and this money, it will be burned. So that's the name of the game when it comes to innovation. You cannot say, I want to spend money, but I want definite return. In innovation, the opposite is it's completely the opposite. Most likely, you're going to spend a lot of money and you might not get your return on this money. So with that mindset, maybe it doesn't well established in the healthcare innovation sector. You can find most of the innovation and venture capital goes to fintech,
Okay.
but not in the healthcare. The risk is high, so I can feel their pain. With respect,
صحيح.
I'm sorry.
لا
Go ahead.
تفضل please.
So with respect to collaboration, I think if you have a good understanding of the governance of the project, most of hospitals will be open to collaboration. Currently, we're talking to a new startup. They're going to have a sandbox in our hospital. We have legal documents documenting the right and the responsibility of each parties, the confidentiality of the patient. The data has to be in prem. We cannot transfer data on the cloud or somewhere else. So if you have all this and assurances to the hospital administration, I see no reason why they should stop you from collaborating with them. I think you can pull other governmental entities to help with this, help with this resistance from providers, if you would. Thank you.
يعطيك العافية, Professor Ahmed. And since we are on the topic of sandbox and innovation, I wanted to turn to Dr. Najla. From your perspective, how do decision makers in the government entities evaluate whether these startups are ready to be implemented or even create an ecosystem for them from funding and regulations?
Yes, thank you. In fact, I will build on what Dr. Mariam and Dr. Sana just mentioned about the lack of funding. For us in MOH at the beginning, and when we started in 2016 as an innovation center, we were putting a lot on our shoulder. We were very keen to help every entrepreneurial or every innovator to go through the whole journey from funding, from maturity of the ideation, from providing subject matter expert, all this through the whole journey or the let's say of their invention or their idea. We were putting a lot on our shoulder, and by the let's say the transformation that has acquired in the system and in the healthcare, a lot of other entities, not only inside the health sector but also within the ecosystem of innovation and research, has came. And these are the main players to help in funding, in providing the complete ecosystem. And now we realize that our job or our main mandate as a governmental, let's say, entity or as a policymaker and regulator is to provide all the strength that we have, where we provide the sandbox, where we provide the environment, and for them to test or to prove of to get the proof of concept for their product or for their solution or for their let's say application or invention. So this is actually what we have been focusing lately for the last 2 years. We have the sandbox in the virtual hospital. For the last 2 years, they're very active in that. They are graduating a lot of solutions in the virtual, let's say, care. And for us in the Innovation Center, we are receiving case by case and providing all the accessibility that is needed for that product or solution to be implemented after, let's say, consulting the subject matter expert, after getting more, let's say, understanding of that solution. Where does it fit and is it needed? And educating also the entrepreneur or the idea holder or the inventors with exactly the needs of that solution and how can they shape it or put it in the right, let's say, direction for them to fill. So focusing on our let's say strength, providing the environment for them to test their solutions is very important. This is what we are trying to do, or we are right now actually doing, and also connecting, let's say, and communicating with the MOH plus. For example, if anyone needed more, let's say, facilitation or letters or paper or any paperwork that is needed for within the Saudi FDA or whatever, then that is our strength to provide. And also at the end, if there is anything with a regulation or something, we can take it up to the leaders or the decision maker to take an action for that.
يعطيك العافية دكتور نجلة. I hear that from you, your experience, that إنه you're there to facilitate basically adaptation and also making these solutions integrated. But maybe let's go back to the entrepreneurs and see what's their perspective. I'll start with مثلا Dr. Mariam. You're an entrepreneur who's working on AI and genomics, and I've met you so many times talking about so many solutions that needs to be integrated. And from your point of view, I wanted to hear, do you think these solutions are integrated seamlessly into the existing workflows, or are there any validation frameworks that is clear for you to support these solutions to be integrated into the hospital system and ecosystem that you're working with?
Oh, thank you for this question. Actually, this question reflect on the Innovation Center at the Ministry of Health. I work with Ms. Najla on implementing Generation Health, and the best demo that, let's say, I get advantage of, that we went to hospitals to check the need, and we visited many centers, and we asked, and we sat actually with many leaders to see if this fit or cover their need. That incubation part would give me the light that I should move on this project, or let's say I would say I see the need of this in our healthcare system. However, the problem after the graduation from the incubation, the value, the need, it's easy to be implemented in hospital. You get all the approvals from the leadership. The problem, how to take it to the market. So I think this is not the role of government. Maybe this is a role of companies, or maybe a nonprofit or organization who would push the innovator, fund them, direct them to the right path to grow as a fully mature startup. Because up to date, we have a lot of struggles. We are self-advised among us. We just try to push as much as we can, but how long we will sustain, it's difficult. And the other thing, that the short the being a part of big companies will shorten the time of development or going to the market. This is not our field. Our field as scientists, to find the need, to work on the need, to do the R&D to improve the product. However, in entrepreneurial, we need more than that. We need gigantic fund. We need commercial team. We need who can take our hand to the market. As a small, we cannot compete with the big companies. They easily can swallow us. However, we try as much as we can to sustain. And I would second the thought of Professor Ahmed when he said sometime you need to fund yourself or push yourself. I did self-funding because I believe in this, and I would say if I didn't believe in my work, I wouldn't fund it myself. So sometimes you need to take the risk, whether it's financial or time from your time or whatever it takes to believe in this idea and go through.
يعطيك العافية دكتور مريم. I also second that, but I'll go back to Professor Ahmed. You've mentioned earlier that يعني some institutes or hospitals actually help supporting entrepreneurs through adaptation. But from your experience, how do you think يعني عشان to work closely with these hospitals and entities, what is their way of evaluating the AI solution, and are there challenges that arise when they want to integrate it? So we can, if we fully understand that, maybe we can come well prepared once we have a solution that we want to present to a hospital. Dr. Ahmed?
انا دائما اقفله عشان لا تسمعوني وانا اكلم بالجوال. I'm sorry. What I'm saying is the role of the hospital in this collaboration would be to provide data and to provide a place to test these solutions. So that's the role. We cannot fund. Sometime one of the companies that came to me, they said, we want this x-rays, blah, 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 and we want some annotation of this x-rays, and that's gonna need more work from my staff. Who's gonna pay them? I cannot include the time that the workforce gonna provide to the company beyond their clinical commitment. So if we have a clear understanding everybody's role, that will be really easy. So my role, when they come to me, I tell them, I'll give you access to the data. I'll give you a playground. You can test whatever you want, provided the data stays in premise and we don't incur any cost. And if something comes out of it, we have to have a shared agreement as how we're going to divide any new solution or any revenues that come out of this. So that's my basic needs and commitment to the startups. They really, some of them, they do not come back because they struggle with funding. If you want to give me, I'll give you that company was asking for 200 hour per month for a clinician to annotate an image, and they don't want to pay for it. And I cannot ask somebody to do extra job without having been acknowledged, or at least stipulated that this might be detected from any revenues in the future. So that's the thing that we're going to discuss with them. Data, you can have will be your sandbox, privacy and governance, and money.
يعطيك العافية دكتور أحمد. I hear that يعني I see there is the readiness. I see that there is a support from the government, but maybe there is no clear, and I could be mistaken, but there's no clear strategy of technology transfer between the entrepreneur all the way to the market. There is that disconnect in the ecosystem. The government does offer policy support or the sandbox, but then once they're in the market, there is that need for funding, and these challenges, especially in the healthcare system, it's higher than any other sector, and I believe because we have the highest risk. And maybe if Dr. Sana, in your point of view, because you offer solutions that will make a doctor's life easier. And you've mentioned that you've worked with agency outside of Saudi, and maybe from your own perspective, you can lead the conversation and say what would be better for us to not hold back our startups from reaching large scale commercialization, and how other plans that we can implement in the ecosystem that can support these entrepreneurs to thrive.
See, I think my answer is just going to be a summary of my fellow panelists, because while listening to them, I think they're speaking words of gold. Professor Ahmed clearly mentioned that, first of all, entrepreneurship or innovation is a mindset. I think that is my number one, because once you have the mindset for it, then, even the finances, the funding, all of these problems seems small. See, at end of the day, we are humans. We are driven by passion. Dr. Mariam mentioned that she has self-funded her startup. It's the same with me. It was saving my own salary and investing in something which I believe in. Now, coming and also very well explained about the processes by Ms. Najla and Professor Ahmed both. Now, there is a gap. Definitely, there will be a gap. This is a new industry for everyone. But Professor clearly said, do not invent a solution for a problem that does not exist. So for me, it's a dialogue. It's for me as an entrepreneur, if I define myself, it's important to be part of these type of sessions, because you are involving the administration, you're involving people from the institute. So it's helping me to communicate with them. The next step for me as an entrepreneur, it's going to be a brainstorming session. Sitting with you, telling you, see, this is what I know about technology. This is the latest thing. This is what I think it can offer. You as a scientist, how much do you agree or disagree with me? Once we are having some common things between us, then is the mindset that, okay, now there is a risk. Whether we jump in, we try this, or we try it, or we just give up on it. The gap in the strategies, I agree, but for me, I don't think it's a challenge. A gap for me does not necessarily mean a challenge. If there is a gap, it's going to be filled by who? By us. Why can many of the government policies and strategies can be shaped by the community's own initiatives, community's own trends and paths that they're going. So I think, again, for me as number one, a scientist, then passionate about innovation, it's important to keep going, not to stopping, finding likewise like-minded people. Just like in this panel, I've worked with Noor, I've worked with Dr. Mariam. Um, a lot of the time we don't come up with a product, we just brainstorm about the ideas and what can happen. And then we connect on a bigger scale, and so on and so on. So for me, it's important not to stop. It's okay to identify gaps and work on them, but don't think of anything as a block on your way.
Dr. Sana, I wanted to ask you, since I love your energy when you talk about entrepreneurship, but I also wanted to, and we've had this discussion before, the regulatory part, and I think this is a struggle for not just entrepreneurs but also scientists and doctors. And I wanted to know, from your point of view, what are the most major challenges that it navigate you away from achieving your goal, especially when it comes to compliance and policies?
Yes, again, this is a very important question. Talking about regulations, I think that is always the most important question. For me, I don't see it as a challenge. I see it as a blank canvas. So it's not stopping me. In a lot of places, we don't actually have policies that stop us. We have policies that don't guide us. So again, going back to my previous answer, see, imagine there is nobody who is capable of defining those policies. Policies are defined by people based on experiences, and that is what we are working on. We have to continue believing in ourselves and step by step proving the success of our innovation or our research to the bigger aspect. It's going to happen by collaboration. It's going to happen with a multidisciplinary team, just like this panel, which is having doctors on board, administration, entrepreneurs. This is actually how it has to be translated in real life in order to basically drive policies and drive innovations. I'm part of multiple committees where we actually write guidelines and policies for using XR in general. There are safety related guidelines, there are technology related, visual related guidelines. There are things related to the hardware. It's a wearable technology. It's similarly in the other innovations like AI and machine learning. So I'm very positive. My answers will always be very ambitious and positive about the change that we can all make together when we collaborate.
Beautiful. Dr. Maryam, I know that we've been working closely with the public health department here at Faisal University, and we discussed a lot on regulatory and policies. And I wanted to hear from your point of view, especially that there's a lot of research happening on these struggles. And I wanted to hear, as a researcher and also as an entrepreneur, what's the major struggle, and do you think that we're getting closer to solve this issue?
I think there is still premature regulations and strategies regarding to the startups. I was running an accelerator with a private company, and I noticed that companies sometimes be aggressive toward the entrepreneurs of taking high shares, or sometimes asking them for things they should not. There is no legislations, there is no policies to protect entrepreneurs, especially innovators who's taking things from the bench to the market, with what is right and what is wrong. Different institutions have regulations, but not all of them, and especially if they are dealing with companies. So maybe having a regulatory or an entity who cares about preserving the right for the entrepreneurs or startup owners, defining what's right and what's wrong, might help a lot.
Maybe we can reflect your answer to Ms. Najla. Since you're part of the MOH in the innovation department, are there a clear outline regulatory framework that protects the entrepreneur or the innovations, and how hard, or first of all, is there an existing pathway, and how hard to gain these approvals?
So let me be very, very transparent in this. When we started the Innovation Center in 2016, we started our scope internally on our, let's say, employee. And they're not like few. We were 270,000 employee back then for the Ministry of Health across the country. Today we are reaching more than 300,000, let's say, employee. And that was for a reason. When we started internally with our employee to have the innovation center to provide to them the facilitation, the ideation, the incubation, we started with them because we didn't have any policy back then to protect their ideas within, let's say, the entrepreneurial, let's say, perspective or point of view. We were focusing more on the culture of innovation inside the ministry, where we wanted them to start ideation, have the internal process for to submit their idea, reward for their ideas. But after, during these 8 years and all the, let's say, the changes that is happening, we had to let's say engage with the community. We had to engage with individuals, with entrepreneurs. Right now we have signed a partnership with the Saudi IP, وحدة الملكية السعودية الملكية الفكرية. We have written the policy of IP for employees, and what is our relationship with them, what are the percentage, the contracts, and also shaping the policy for the entrepreneur coming from outside. So it's still, as everyone mentioned, the industry itself is not mature yet, but we are on the right path to reach a very clear, let's say, path and a very clear policy for everyone to contribute. Mostly, our contribution right now, as we said, we contribute by designing the challenges, providing the opportunities that we need, whether from the hospital, the priorities of our objectives, the needs that we tackle every day, providing this chance for everyone to understand more, opening the dialogue, as Dr. Sana said. We're open to receive individuals, entrepreneurs, investors, everyone within the ecosystem, who are researchers, innovators, to understand more. We can provide the data, we can provide the facilitation, the communication. This is what we can do right now, and also on the right, let's say, path to shape the policies for their rights and their, let's say, property, intellectual property needs. I hope
يعطيك
that
العافية.
answers.
يعطيك العافية Ms. Najla. It's clear from your answer and this discussion that while regulation is necessary, بس it must support innovation rather than hinder it. And we can see the efforts that's happening at the Ministry of Health level and our ecosystem. And since we are near to conclusion, I'd like to ask everyone one final question. And maybe if we start with Dr. Ahmed, if you could change maybe one policy or one structural element today to accelerate AI adoption in Saudi, what would it be?
I will make sure that our AI startup have an office inside the ecosystem, embedded in the hospital, because they can have the spark of looking at ideas and the feasibility of developing a solution. I think I'm still insisting that people in the ground, if they're not close to the people who are suffering from the problem, they will not be able to design what they want.
صح. صح. I agree with you. I totally agree with you. It's actually going to be very beneficial to have that. Ms. Najla?
I would say, from again, maybe it's purely from our perspective as a governmental entity. I would say alignment with everyone, alignment and communication with the everyone within the MOH, let's say, plus ecosystem, or within the innovation and research, let's say, industry. We need to do a lot of alignment, saying that because I see how much effort has been given in a lots of projects, but without having alignment and that dialogue between the governmental sector, without having that opportunity open to the entrepreneurs, to the investors, it would be much easier for us to sit on one table, talk, understand exactly what are the strengths of each of us, and what are the opportunities for others to help in. And I see this is a great thing to do, and it will be a game changer if we all sit on one table to talk together.
Agreed. And it's the most sufficient and fast way to do that, actually, if you brought all the stakeholders in one discussion. Maybe Dr. Maryam can tell us from an entrepreneurial perspective, what would you change?
From my side, I'm not entitled to add any changes. However, I would say recommendation for maybe I'm not aware about the thing that's going on with the هيئة الملكية الفكرية, which is really great, and I'm happy that they start to consider the rights for each party, whether it's an entrepreneur or the institutions. But I think highlighting where to go, or at least drawing a roadmap. Let's say if there is an institution will benefit from this product, make sure that it will reach, not stop and due to politics, due to other benefits, or due to lack of funding. If this product value and will add value to the healthcare or to any other institution, or let's say disciplinary, if there is a regulatory who believe on the product and draw the roadmap for execution, that will ease a lot, because sometimes politics play a huge role. Politics with two institutions together, and you don't want the entrepreneur to get in the middle. There is no regulations, or there is nothing, no fund or whatever. If there is an entity will take this or take the lead to introduce the product into the market, that would be great. We do a lot, whether it's research or creating tools, or maybe working on AI or others. But the problem is convincing the leads is not a problem. The problem is how to introduce it without navigating all the politics and delay and everything else. I worked, as I mentioned before, with Najla. She shortcut that, but you don't find this everywhere. You don't find it in other institutions. You don't find it in universities. Having a roadmap that accelerates the process after graduating from an accelerator, that would be great.
Great answer, Dr. Maryam. And maybe we'll end this on a positive note with Dr. Sana. If you had that magic wand and change something, what would it be?
Okay, first of all, I wanted to answer this just by thanking Noor for moderating the whole panel so gracefully, and all of the questions that you have been asking, they were very good until this last one. It's actually a tricky one, but let's see. I wanted to say that, see, I think that we are very, very privileged to be in a country or in a region where we are blessed to have visionary leadership from the governments, from the policy. So I think we are very grateful for that. The rest of the gaps, we are much better. Even the government is focusing on non-oil economy. So we do have in our favor many, many benefits geographically. Your question about magical wand, I think I would want, probably that will be solving the problem that we don't have, which is guidelines and policies. A magic wand, which is instantly giving us the policies to implement healthcare globally with equality. To help us democratize healthcare, whatever I am getting here as a privileged citizen in one of the most, rich cities in the world, I want the same opportunity in healthcare for anybody who's sitting in a third world country. I want the equality for human life and human health and the value of it. That is the most important thing. And once we have the health, then we can see the other aspects, which are education, progress, higher education, and so on. So that's my answer. I hope it conveys the message.
يعطيك العافية. Beautiful answer indeed. And it is important that we look beyond our own circle when we think of a solution. It is important that when we are promoting for innovation or AI solution, that this is not going to be expanding the segregation between low income and high income countries when it comes to healthcare. We're hoping that we are building an artificial intelligence ecosystem that can convey that can actually connect the disconnect, and can actually help everyone and not create another reason of inequality or discrimination. And with that, I would like to end this conversation and say thank you so much for this beautiful, insightful information from all of our panelists. They did show us that there is transformation that's happening, and actually, because I know most of them in person, I know that there is a lot of collaboration that's happening between policymaker and institutions and startups, and I'm sure that with this sample of people, we can actually overcome the challenges that we've discussed if we start, expanding this connection, this collaboration across others. And with that, I'm gonna hand over to Dr. Asma and have a great day.